Welcome to the Rehab Lab. Today's guest is with Dr. Paul Brumett. Dr. Paul has practiced small animal medicine for over 20 years as a general practitioner, emergency veterinarian, rehab veterinarian, and a veterinary chiropractor. Excited to have Dr. Paul joining us from Junction, Colorado, and sharing his knowledge and experience because he speaks nationally and internationally on custom orthotics and integrative medicine. So this is a great conversation to incorporate how does the Wave and Shockwave therapy work in conjunction. You saw that there, Junction conjunction, into most medical practice. So with that being said, let's get right into today's conversation with Dr. Paul Brumett. Dr. Paul, welcome onto the podcast, man.
Thank you. It's a pleasure to be here.
Well, I've been through Junction once or twice. Being out there is beautiful to me. I think you guys have some of the best aspects of the country to me. It's something that is just unique to Colorado and the whole mountainous area. Me being on the East Coast, I get a little jealous every time I think about some of the mountains that are somewhat close to me throughout like Tennessee. I mean, you guys get the real views over there, man. So it's one of my favorite parts of the country.
It's beautiful. I grew up I grew up in Kentucky and Florida, so I know what it's like to deal with humidity and
Yeah.
what it's like to drive down the interstate and not be able to see anything because the trees or the kudzu are so high. And so that it is when I've lived out here for over 20 years now, and I'm
Mm.
used to seeing to the horizon. And so whenever I visit back home or I'm on the East Coast working, it's still a little bit of a shock to not know what's around the next corner. But man, it's always fun to pop back into the humidity because it's so dry here, and, and just it's nice. It's nice. I enjoy going back to the East Coast, but I certainly love it here, and there's a ton of cool stuff to do here, so, it's a little slice of paradise, yeah.
100%, man. One of the things that I think is interesting that's happening in our space around rehab is just that the word's getting out, which is great. I've been in this space now for about 8 years, and you were saying how that's one of the reasons why you kind of made that switch as well, is because you're just seeing that you can impact more and more people because people are getting better outcomes. It looks like, and
Yeah.
what are you seeing right now from like gold standards when it comes to just trying to treat just like overall, different issues? I know you've been doing Shockwave and you've definitely been doing bracing, but let's kind of talk about from a 30,000 foot level. What are you seeing throughout this vet rehab world?
Yeah, well, I think all of us are trying to figure out the best ways that we can help a pet, and if we want to talk about stifles is always a big thing. I mean, how much are we charging for a TPLO or a CBLO or a TTA around the country? And it can be anywhere from $3,500 to $6,500 for a procedure, and that includes a lot of things. And some of the veterinarians out there are doing phenomenal things in surgery. They're leaving lubricants in the joint as they leave, and they're doing postoperative therapy for a number of treatments after surgery so that they're getting better outcomes. So and those are the newer generation veterinarians, in my opinion, because they've been exposed to that, which is fantastic. I mean, that's where we're headed. Um, but I think on the flip side of that is what do we do with our patients who can't afford $3,500? For the stifle, in some cases, folks would even say, "Well, all we can do is pain medication and hope." And there's so much more that we can do somewhere in the middle of that. And I've always said, as a veterinarian, my job was to know what like I used to Sears and Roebuck used to have the good, better, and best, right? You remember
Yep.
that?
Yeah,
Like you could buy
100%.
the good tool, the better tool, or you could buy Craftsman. And you know, um, you need to have all of those things in mind, right? I mean, even
Yeah.
the good is still good, right? I mean,
Hmm.
it's still you can relieve pain, you can help with joint function, you can give quality of life to that patient. And if we're talking about a stifle surgery, then that means, in my mind, so they can go to the bathroom, they can interact with their owner, but they're not going to be doing police work anymore if they're a police dog, and that's where surgery sometimes has to come in. Is the only way we're really going to get that level of function back is to do surgery. But I think as I'm explaining this to you, I have this conversation with an owner, and then they can make the decision what they want to do. And so I think it's really nice to have all these options and be aware of them. And then, as veterinarians, we always want what's best for our clients. And so that's a really good thing. But sometimes as veterinarians, we forget that we can present them with all the options and allow them to choose. And we've got studies to show that, I think. And definitely if you talk to enough veterinarians, especially if they're early in their career, they struggle with that.
Mm.
Um, but at the end of the day, if I can help a patient, or if I can help a clinician help a patient in my role now, so that they have a better quality of life, then that's a win. And and so yes, things are getting more expensive. Pet insurance is out there. You can everybody's got their stand on pet insurance, but certainly if you get a dog who has pet insurance early and they have some type of orthopedic issue or an issue that rehab needs to help, then there's usually money there to help take care of that.
Right.
So that's a bit of a balancing act, but that helps decrease that cost. But there are a lot of things that we can do. Even if we only see a patient a couple of times, we can uh, teach an owner how to move forward with exercises and that kind of stuff to help them. And then, of course, with some of the pieces of equipment and the extra skills that we can learn, like animal chiropractic or acupuncture, we can myofascial release, all kinds of stuff. We can make a big difference as well in other ways. So it's yeah, it's just, I mean, it's exploding. It's just so huge. There's so many vet schools or rehab schools. We have more vet schools that are coming online. All of the new veterinarians are being exposed to rehab in some way, which 30 years ago we didn't talk about rehab. We talked about post-operative care for the first week or two and what we would do, but we didn't talk about all the things that we do now, and the education that I've gotten that I can use. So we've come a long way. We've got
Well,
some stuff to learn, I'm sure, but there's smarter people out there than me that are figuring stuff out.
well, man, I mean, I think it's great that things are just moving forward. Like at times, I know we all wish that certain things might want to happen at different paces, right? I mean, you wish
Yep.
that there were things happening at a much faster pace, and every once in a while, you almost want to try to slow them down.
Truth.
But just the fact that everyone's being exposed now, that's coming out of school to rehab and prehab and thinking about things, earlier on in their career. Is that something that you are seeing that's being adapted by most vets now? Or you say that most people have a specialist that they're aligned with, or they're pretty much open to it, or is there still kind of that, there's still kind of a little bit of relearning and re-education going on?
It's interesting, and I don't profess to understand this really well, but if you look at the United States, you have population centers where people are early adopters.
Hmm.
So like Denver, Colorado is that way. If you go to Denver, I say you can throw a rock and hit a rehab clinic. I mean, there are a ton of rehab clinics in Denver,
Yeah,
Colorado,
great
on the
ones
East
too. Yeah.
Coast, and great ones. Yes,
Hmm.
absolutely great ones. The East Coast, Florida, the West Coast. I mean, they're very on top of those things, and a lot of large metropolitan areas have that. And then we have areas of the country that just have general practitioners. I mean, so it's not widespread, and we certainly run into pushback sometimes. Certainly with, I mean, acupuncture, chiropractic as an example. I mean, acupuncture has become fairly well accepted in veterinary medicine, but I can remember 20 years ago when everybody looked at you like you were crazy. And and it's a phenomenal. It's Acupuncture is not for me because I can't sit still that long. But so that's why I do chiropractic and animal chiropractic and other things. But and when I have a dog that I really was like, boy, this dog needs acupuncture, then I refer them. But yeah, where people are still accepting things, and a lot of the manual therapies that we do initially were just based in clinical results. Like we knew they were helping, but
Right.
we didn't have a scientific way to really prove that. And now we're able to do a lot of that. And I'm sure that 20 years from now we're going to look back and go, oh, we weren't really sure about that, and now like, oh, it really works. I mean, and
Hmm.
Shockwave's like that kind of. If you think about it, like people are like, oh, it's just a we're just we're hitting the tissue and we're causing inflammation. And it's like, oh, wait,
Yeah,
it's way more than that.
that's right.
And then probably, 5 years from now, we're going to be like, and it also does this, and it also does that. And so, yeah, we're moving ahead, but and I agree. Sometimes it seems painfully slow.
Yeah.
Why don't we have this technology? The humans have been doing it for 20, 25 years, although I think historically it takes about that long for something to be inexpensive enough for the veterinary profession to pick it up and start doing it. And then it's usually the specialists that are doing it first, or the veterinarians that are kind of on the point of the spear that like to try out new stuff. Um, and then it becomes, like TPLO, right? Like there's lots and lots of folks now that are doing a TPLO surgery. But back in the early days, you pretty much had to go through a special school and you had to be a specialist to do it. So we're coming along.
It is, you know, what's kind of cool is always looking at these timelines and thinking that at one point what we thought was like archaic today, you know, like, oh, they're doing that. And now, but at one point that was the thing. That was the innovation of its time, you know, and I think it's always important to kind of recognize that, especially like in, you know, med tech, medical device, and thinking about the first time I had any type of shockwave done on myself, I was like, oh, everybody's gonna get this. This is gonna take hold immediately. And I'm an early, you know, guy that can be a little bit early on different things at times. And yeah, you know, it's taking its time, which is fine because it during that time that it's coming out, it's also getting more and more, you know, data to at least back up a lot of the claims that people were just feeling either way, right?
Sure.
And I would love to kind of get your thoughts here then about some of this other tech that's out there. So we have Shockwave. How do you explain Shockwave to people? Because I have my talking points, but I would love to hear whenever you're talking to other, you know, vets, like, hey, what is Shockwave? Is it all I'm doing, Paul, is just restarting the whole like healing process and just putting a lot of energy in there and getting things going again, right?
Hmm. Yeah, it's for the veterinarian, yeah, I'll try to approach them more on a scientific level.
Mhm.
Say, hey, so this, the shockwave goes in, and we have this mechanical transduction, and we know that if I'm saying that right,
Yep.
and then that creates this cascade, and we know that cascade increases blood flow, and it helps with healing, and it actually reduces pain. And we have several mechanisms that we can talk about and why it reduces pain. We have the research that shows that it can be used for non-healing fractures, right? So you can throw that out if you need to. Um, and then you just start talking about outcomes, and then if you can get them to try it, that's the other thing,
Yeah.
you know. And with my patients, it was always, this is something that I think would really be helpful for your pet. And yeah, you just, I don't get into, I might talk about breaking up stones in the kidneys because people have heard of that.
Hmm.
And
Hmm.
then I say, this is this, so we can break up stones with sound waves, right? Or with a wave of energy. So this is creating a wave of energy, but it's not near as strong, but it creates healing. And and we can get into that if they really want to, and how that happens. But and then I just let them, I demonstrate it on myself, and then if they want to see what it feels like, we turn it down low and just let them feel it, and they're like, oh, that's not a big deal. And then usually they're in. Some of it too is just trust. I mean, when people come
Yeah.
to see me, it's because their animal's uncomfortable. They're having a problem. Usually they've been referred to me, or someone referred to me by a veterinarian or a friend, or they found me on the internet. And then it's just a matter of this is something that I think is important. And we talked. I think last few weeks ago we were talking about charges, and that's, I know you've talked about that a lot, I suspect, and whether
Yeah.
you charge per session or just charge for your time and then do whatever you want. And I think both ways are fine. It's just whatever works for you.
Hmm.
But I always charge by time. So when I said to my client, I think this is important and I want to do this other thing, and we'll see how much we can get done in a matter of time. The buy-in's pretty quick. They're just like, oh, just do whatever you think is going to help. And then usually after two treatments, I have people who see response within the first treatment, and they're like, I don't know what you did, but it's working, right? Or whatever.
Yep.
Yeah.
Yeah. Yeah. You know, and there are those two different schools of like thought too when it comes to how to charge and what's the right pricing model for your practice. And, yeah, personally, I always tell everyone this too. Like, I like the flat fee model. I know what I'm getting once I go in. So it is the time, pretty much saying, hey, I'm buying this amount of time and whatever you think is best, Paul, just have at it. Right. And,
Yeah.
so pretty much just kind of buying into that actual trust. But I also can totally understand someone wanting to do the a la carte. But when I think about putting it with other devices and having that like more that multimodal approach,
Yeah.
especially with like especially think about bracing and like other tools that some of your like clients might take home. Like, how do you kind of mix it in with that piece of it? Because I think maybe at least from some people, trying to understand what's the right way to kind of put things together, especially if you're going a la carte. I mean, obviously that could be a little more of a challenge, but going with the flat fee model when it's just like the world's your oyster and you have access to these tools, how do you kind of go about putting those pieces of the puzzle all together?
I think the first thing is, what's my diagnosis?
Yep.
What are we treating? And then, what can the different modalities that I have, what can they affect? And certainly there's a lot of overlap, which is actually kind of nice because if you don't get to something one day,
Hmm.
there's a good chance you touched on it anyway. The other thing is what will the animal tolerate? Right. So some animals are really sensitive to sound. So if you don't have a laser that you can turn the beep off, or if the machinery that you're using is loud, then they're reactive and you can't get them to hold still. Other times am I trying to decrease inflammation? Am I trying to help with tendon healing? So really, some of that depends on what I'm trying to do, and then of course based on studies as well, right? So, just like I said, a non-union fracture, we know that Shockwave is really helpful with that. We know that Shockwave is really helpful with tendon injuries, and for shoulder injuries, it's one of your go-to treatments. And I've had a lot of success using it with shoulders, and rehab, and of course we have other things we have to do too. But so yeah, it's one of those. It's like it depends, right? The answer is it
It
depends.
is. It does.
Yeah, some days, like, I've had dogs, it's like, "Nope, no, we're not getting laser done today. It's just not gonna happen, he's not gonna hold still." So then it's like, "Well, what else can I do?" And so then I step away from the things where they have to be in one place while I'm doing it, and we start to do something else that's more active, or work with them. But yeah, I think, try to go back to and answer your question as specifically as I can. I really look at what are the patient's problems, what stage of healing are we in, what are they capable of doing, and what will they allow me to do. And then
Right.
since I charge by my time, then it's like, what tools do I want to get out? And certainly if I've got a stifle that we're going to treat conservatively, so we're not doing surgery on that stifle,
Mm.
then the shockwave comes out. I'll use laser on those as well, and we discuss bracing. Yeah, so that's a big part of it, and I have had clients who only wanted to do therapy. They didn't want to do a brace,
Wow.
and some of those will do okay. I mean, there's a lot of we have dogs that are lame and have a cruciate ligament tear. I think there might be a system out there that somebody's grading knees, but there's just so much that's going on in the knee
Yeah.
that you can have dogs that do really well. I mean, we have copers in dogs as well, just like we do in people that have anterior cruciate ligament ruptures. So
Okay.
the dogs have a full tear, and but they do okay,
Yeah.
right? They're not going to run marathons, but they do okay. And I've had clients who had an ACL tear, and 2 years later, they're walking 6 miles a day.
Wow.
And they did physiotherapy and never went to surgery. And I feel like I recently read that the human model is actually the pendulum is swinging back away from surgery and more towards physical therapy.
Yes.
So that's probably going to happen in our world as well. Um, and we're also changing our husbandry practices. So
Hmm.
we're starting to talk about spaying and neutering much later in life if we can. If there's not a reason to spay them early, which sometimes we do need to spay them or neuter them early because they're going out into the world, and we're not sure if they're going to create a lot of babies or something like that. And we're trying to prevent overpopulation and those issues. But
Yeah.
some of these growth plate issues that or some of these like this some of the stifle disease has been has been kind of correlated with how long the estrogen and testosterone are there.
Interesting.
Yeah, so if we spay or neuter them later, we see less issues. And
Ah, yeah.
yeah,
Okay.
so it could be that in 20 years from now, if things change a little bit, that we won't be doing as much knee surgery. You know,
I mean, yeah, at this stage of the game, it's really difficult to like, at least for me, to predict what's going to happen more than 3 to 5 years. I mean, come up with like somewhat of an accurate, we're all
Sure.
pulling here out of the sky, but there's just been so many changes, and you look at so many more advancements that are out there these days, and on one hand, it is a beautiful thing, but then also, trying to understand what the patient actually wants, kind of what you were at least alluding to a little bit there with the whole human population. I think people are at this place where they're like, I want to try or at least exhaust the things that I can do through like physical medicine, corrective exercise work before I have to, jump into any type of deep surgery if it's not
Sure.
needed. And then of course try to avoid any type of like pain meds, right? And I think that's great because having that hopefully what I believe is happening, that pendulum going towards that whole direction, is going to open up a lot more conversations about how these things work together. And so once we think about bracing in particular, you mentioned that some of your clients would opt out of braces. Just for the general conversation, why would you want to do, shockwave therapy, light therapy, and then bracing? Like, what's that whole thought process of why that makes sense for you?
Well, I think the shockwave for me went well. I keep talking about stifles, and it just in the orthotics world, this stifle brace is what if actually there's just an article or study on what the most common brace was, and they just polled all the companies that make them basically, and everybody said a stifle brace, and that's what we see in our company as well.
Hmm.
And it's a huge issue. Cranial cruciate ligament disease in dogs is a huge issue. I really feel like Shockwave helps those knees with their inflammation. It helps them to heal faster. We talk about inducing stem cells and I've just clinically seen them get better. And I have had some dogs who I would call a low. This is my own term, a low grade stifle, a low grade cruciate where they're fairly stable. Um, meaning that they can put their weight on it and they're not always toe touching. They don't have a meniscal tear,
Hmm.
that I treat them with just my normal rehab exercises that I would do to help maintain muscle mass, proprioception, body awareness, that kind of thing. And I'm looking at my Shockwave machine because it's sitting over here beside me, and Shockwave, and we don't need to do anything else.
Wow.
Now, could that dog be one of those kind of Coper dogs we talk about? Right?
Mhm.
Sure, absolutely. And I've had that happen with pit bulls, and I've had that happen with other breeds as well. And then, some of them are so unstable that I really feel like we need to have a corrective force applied, so brace. And
Mhm.
so then the corrective force keeps the knee from going through that tibial thrust range of motion that stretches all of the ligaments and the muscles and creates so much discomfort and pain, as well as causing lots of inflammation that then leads to arthritis. So, so if they're really unstable, a brace makes sense to me because we're trying to hold things in place while they're walking, so not so one, so they're more comfortable, but also so that we can allow for functional scar tissue to form, which is very similar to what we did with an X cap. So when we did our lateral sutures, we're just holding things in place because we know that's going to break
Yeah.
in 6 months if we're lucky. Hopefully it doesn't, some of them break sooner. But if we can hold things that way long enough, then we'll get some functional scar tissue. Are those dogs going to run marathons? Probably not. Are those dogs, is that the right surgery for a police dog or a dog that has to function at a very high level, a military dog, a service dog? Probably not, but it's an option for some people. And I know I'm banging around a little bit,
That's perfect.
but so I kind of look at the brace as that, and it is a lower cost way. I'm not going to say low cost. I'm going to say lower cost way of treating a knee because, by the time you've bought a brace, whether it's a ankle brace, a wrist brace or a knee brace,
Hmm.
you're going to be in the neighborhood of $1,000 to $1,500, depending on the company. Some are a little cheaper, and then you really should be doing rehab too. So there's another $500 to $1,000. But when surgery is 6,500,
That's
that's
right.
a lower cost option, and we get a lot of good results. And nothing is perfect. Surgery, we can always have complications with surgery. Good surgeons have complications. Any vet worth their salt will tell you the cases that didn't go the way they thought they should, even though everything went perfect, because that's life. And we understand that, I think. Um, and bracing's the same way. We'll always have a small percentage that just for whatever reason it doesn't work out, but the vast majority of them we can help them with bracing. And if we can't do bracing because that's not in the cards, then we still have other things we can do, right? So
Yeah.
that's part of what makes what I do now as a rehab veterinarian. It's nice to have all those options, because sometimes you will hear from a client, don't always know what's actually being said. I've always been careful my entire career not to put words into the veterinarian's mouth when someone got referred to me,
Hmm.
because what's said in the room, what's actually heard and interpreted can be totally different,
That's right.
because the client's stressed out, right? And so
Yep.
they're only hearing half of it because they're worried about their pet, right?
Yep.
And the veterinarian thought they did a good job of explaining it, but now they've got to go because they've got another patient. And
Hmm.
and so yeah. So you always have to be careful about that. I always have been, but certainly uh, and I'm going to lose my track here, Joe. The we'll get back in somehow, right?
No, 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 man. I mean, man, to me, this is all good to hear your actual thought process, though, because
Yeah,
I mean, to me, these are the conversations that a lot of times people just aren't in the room with when they're thinking about
right.
how are their patients going to think about spending 6,500 to maybe 1,500 to 3,000, all those options like in between, and whenever we think about having functional scar tissue, this is one of the things that you brought up. You aren't concerned about the actual shockwave breaking down that actual functional type of scar tissue at all?
No,
Yeah.
I've never thought of it that way. Yeah,
Well,
I think we're creating a positive environment in the joint with the shockwave so that it can do whatever it can do to heal. And that's
yes.
part of what we're allowing. I mean, we know the cruciate's not going to come back.
Right.
If we can decrease the inflammation, if we can help the medial and collateral ligaments get stronger, if we can help the joint capsule be happy and healthy, if we can increase the blood supply of all of that, because we know there's not a good blood. I mean, the blood supply goes up to the joint capsule, but it didn't go inside.
Right.
So if we can, so there are lots of ways we attack that. So range of motion helps move the fluid back and forth. We move the fluid back and forth, then it goes across the inner lining of the joint, and it gets oxygen and nutrition and medication and all that kind of stuff, right? Well, if we can decrease the swelling through all of the different things that we can do so the dog is more comfortable and they can walk more, then they'll do that on their own. And then
Yeah,
we
100%.
right, and then we lose less bone mass. So yeah, so I'm not really worried about the functional scar tissue breaking down with the shockwave. Honestly, this is the first time I've ever even thought about it because you brought it up.
I mean, man, you know what? On the actual human side, it's a pretty common conversation, especially like,
Is it? Yeah.
yeah, yeah. I mean, docs are constantly asking questions about that, and but I think it's more important about what you said, obviously, right? Getting people functional again, getting them moving is way more important than trying to keep that in like tack, right? And most of the time, we're not putting enough energy to actually break it down or have that actually remodel in the very beginning, anyway. I mean, and thinking about just kind of things that you've learned just from being on both sides, like any takeaways from maybe especially for vets, like people that are like, hey, I didn't know this was going on the actual medical device side, or the bracing side of the business versus what you might have experienced once you were actually in the clinic.
Yeah. Well, I think we're all really time. What would it be? We're all really short on time,
Oh yeah.
and I get that.
Yeah.
And one of my buddies who's a veterinarian, as someone who represents the industry now, right?
Mhm.
And we have a full line of products. I was talking to him with one day, and I said, sometimes I make cold calls, right? Like sometimes I just know I'm in an area. I've got an hour or two. Let me stop into a clinic and just say hello, drop off a brochure, see if they have any questions, see if they're already using our stuff.
Hmm.
And in some places, you'll never get past the front desk. And that's fine because if they want to, but in other places, they're like, oh, yeah, come on back. Our head tech or, the office manager has time to chat with you for 15 minutes. What do you have? And
Hmm.
so, yeah, so my friend who's a veterinarian, I was asking him about that. I said, "How do you feel about that?" And he's owned practices for years, right? And he says, "I welcome the new technology. I want to." And he's one of those guys. He's an early adopter, right? And
Hmm.
he's like, "I welcome the technology. I want to see what's going on." So I think it's important to listen to that person or have somebody on the staff go talk to them. And he says, "But you are going to run into those practices where they're like, nope, don't even want to hear about it, don't have time."
Sorry.
And, eventually they'll come around too. I mean, they may be that group. There's that bell curve, right? You have the early adopters, you have the people that once it's been out there for a few years, they'll try it. And then you have the people on the far end that are like, until I see all the safety studies and all of my
Sorry.
buddies have used it for 10 years, um, I won't use it. If I think it's something that maybe is appropriate, I'll refer, right? I mean, and
Hmm.
and there's nothing wrong with any of those places. It's just some of us are, and maybe, I always ask clients like, well, are you a gambler? Or are you a risk adverse kind of person, right? Because if you want to take a gamble, then we can try this. It only works 20, 30% of the time, right? In
Yeah.
general medicine, sometimes that's what you're offering, unfortunately, right? And
Yeah.
then times it's like, well, there are certain surgeries we know that just 50% of the time they're just not going to work.
Yeah.
And for a lot of complex reasons. And then other times it's like, oh, this works all the time. So it's real easy if you're on the far end of that spectrum where you're like, well, show me the research and everybody's been doing it forever and it's safe. It's real easy to say, well, yeah, I'll jump on to that. And I
Yeah.
understand why, because it's a safe place, you know. So some people are that way, and that's okay because we all got to live in whatever our bubble is so that we can practice at a level that we're comfortable with and help our patients. But I think over time,
100%.
people do get exposed to it. I mean, we're talking more and more about it at conferences. The new veterinarians for sure are being, like I said earlier, are being exposed to all of this stuff.
Oh,
And
yeah.
some of the veterinary schools are just, I mean, they're phenomenal. They've got, I call them the toys, right? They got all the toys. I mean, they're
Yep.
doing they're asking folks like me to come speak to their clubs. So it's nice because we can at least share the ideas so that it's not something brand new to them, and then they'll take it to those practices where we've got older practitioners that maybe are a little more set in their ways and and expose them to them that way. And I certainly was the same way when I was a young veterinarian. I remember my veterinarian looking at me and it was intimidating to say, well, what are they doing in vet school now? And I'm like, whoa, wait a minute. I'm here to like learn for the next 6 months, right?
I'm learning from you today, right? Yeah, yeah,
Okay.
yeah, yeah,
That's right.
yeah.
Yeah. I know a lot, but I don't know much.
Yeah, yeah, that's right. That's
Uh,
right. That's right.
teach,
I,
teach me.
I mean, man, you know what? I've always been that guy, and I've been selling various products for, I feel like for all my life, really. And I learned pretty quickly that, man, you just don't know what's going on behind the scenes, and with
Mm-hmm.
different people, and I always try to stay empathetic to that. And whether it's you don't know if they had a horrible experience with a different device, and
Right.
then here you come right behind them, and you have this thing that they're like, no, 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 you don't know what just happened last week, right? And I mean, or it could be something personal too, and all those are valid. And so, to me, it is finding those right people that are open to hearing the message whenever it is brought to them, and for those folks, I think it will make sense, and they'll start going down the whole rabbit hole, right, and really try to figure out what's out there, and then what's best, and the right combinations. I mean, thinking about it, even though I said I wouldn't do this to you, but thinking about the future of the whole
Yeah.
like industry here. Like, give us your 3 to 5 year POV, and it's 24. Take us to like 27,
I
28,
well,
29, man. Yeah.
I mean, I don't know. I think what's going to happen. So we have way more rehab schools
Mhm.
in the last gosh, I want to say just in the time that I got into the rehab sector, we've got several more rehab schools, and they're all good, right? They're all being led by board certified rehab specialists with
Yeah.
wonderful uh, teachers underneath of them. So we've got these fantastic rehab schools, and we've got a lot of students going through them, and veterinarians. And
Yeah.
some of them allow veterinary students. Some of them, depending on how they're set up, are graduating veterinary technicians as well. And so that group is growing and growing and growing. So I think what we're going to eventually see, I don't know how soon, but what we'll eventually see is that rehab is going to become a common part of general practice.
Mhm. Oh,
You
wow.
know,
Okay.
yeah. Now, is that in 5 years? Probably not.
Hmm.
But I think somewhere it will be. It'll be as common as a TPLO surgery. I mean, there's a lot of general
Well,
practitioners out there that are very proficient at doing that surgery.
mhm.
Um, but they had to go to school and then they had to practice and all of that. And I think it's just coming along. And I think the other thing too is that the industry is still struggling with how to charge for rehab, um, so
Yeah.
that so that it doesn't negatively affect the bottom line.
Yeah.
And that will probably always be a struggle because I mean the money side of it has always been a struggle. I think veterinarians as a group, we really want to help people, and we're not very good business people. We just aren't. I don't think. I mean, that's my opinion, right? My opinion. But most everybody I know, it's honestly, it's the technicians, right? The
Yeah.
technicians and the office managers and the folks that you bring in that have the business education. It's most of them that are keeping you in line because you want to help that pet and not
Mhm.
charge as much, so that you can help them. And the client and your staff is saying, but we gotta keep the doors open.
That's
So
right.
finding that middle ground is always been a struggle for veterinarians. And
I'm just
uh,
curious too, like, and we are about to wrap up soon, but I'm really curious about that piece because that's something that we see on the actual human side a lot too, is that people are waking up to the fact that, hey, if I can get ahead of this stuff, and be proactive and do the things to avoid the surgery, at least put it off, or if I have, arthritic joints, doing the things that will help maintain that joint to the best of its ability where it is today moving forward. Um, what do you think the missing gap is that will at least kind of, maybe not take us all the way there to where, it's in every clinic, but, move the actual needle in like a meaningful way? Is it more education? Is it just more value built into how we're, talking about these actual, therapies up front? Or yeah, just curious on what you think might kind of move it a little bit.
yeah, I think there's a couple of things you've touched on. Your questions touched on a couple of different things. One would be for the general practitioner when they have a dog that they think is has early arthritis. I'm using my air quotes.
Yeah,
Right?
yeah.
Is yes, put them on an anti-inflammatory and refer them to somebody who can help them do rehab.
Mm,
Because as you said, if we can get to those things earlier, we can help them
yeah,
and we can prevent some of the longer term effects, or we can at least push them out much further so that the patient has a much higher quality of life.
mhm,
And I've just, as you were asking all those questions, I've just was thinking about the number of clients that have said to me, I wish I would have known you existed a year ago or 2 years ago.
yeah,
Um, because they knew their dog had an issue, but they didn't know where to go. And the general practitioner was like, well, this is what I can do, right? And the general practitioner didn't know either. So I do think that there's some of it's on us as rehab practitioners. We need to go and make sure that everybody in our community knows we're there and what we can offer, um, and that we can make them look better. I really feel that's part of. I mean, we do improve outcomes and with what we do, and so I think that we can make the general practitioner always looks better if they say, you know what, this isn't something that's in my wheelhouse, or this isn't something that we're doing right now, but Dr. So and so is trained in this, and they can help you and go see them, and then they come back to that doctor and say, "Man, that was great. We love this person.
that's right.
They're doing and they're helping us." So I think we need to be better self promoters, and then I don't know how we manage our time. That's the other thing is we all time, like I said, we're all short on time,
That's all right.
and,
Yeah. Yeah.
we got vet schools that are producing, excuse me, they are producing more veterinarians. to help fill the spaces, because we are in a shortage situation right now, and everybody has kind of their own reason why that is, and I have no, I really don't know what happened, but it happened.
Well, and that's what I'm weighing too on that because as you're talking, I think that and this is me being probably thinking through my lenses here and as a marketer, right? And getting into my
Yeah,
marketing lane. And yeah, I definitely think it's more of a micro marketing, like hyper local marketing and just talking to your community and realizing the value of even if you're referring out, how that just keeps you a really good reputation for you. It builds up good, good what do you call it? Just kind of good karma or
good
good
energy.
things. Yeah, yeah. I mean, with your community to know that, hey, Joe's not just gonna try to close me or sell me anything just because I showed any sign that I might be dealing with this, right,
Right.
right? Or
Well, y-
yeah, yeah, or he's not gonna just turn me away, if there's something that's not directly in his actual like wheelhouse. Yeah,
yeah, it's that old what is that? The Christmas Story. It's not Christmas Story. It's one of the Christmas movies where everybody's going to Macy's to see Santa Claus.
yeah,
He doesn't have whatever item it is, but they'll send them to the store that does. And then so it increases Macy's business and everybody loves Macy's, right?
hmm
And it's somebody will know the name of that movie. It's escaping my
like a
brain.
miracle on 34th Street. I'd
Yeah,
imagine. Or
yeah, I
yeah,
think
yeah,
that's
yeah,
it.
yeah, yeah,
Yeah, there you go.
yeah,
See?
yeah, yeah,
And it's true. I mean, I think that helps too, right? I mean, who doesn't want to go to somebody that if they don't know the answer, they find out where to go so that you do have the answer.
that's right.
Yeah, and I think there's a level of stress in the profession right now because um well, for all kinds of reasons, honestly, but if anything we can do to decrease that level of stress is good for us. So if we can say, I can help your pet with the initial discomfort, but I
hmm
know someone who can help you with the other stuff, and we can send that patient on to that client and patient on to another provider that can take care of them. Then that frees you up as the general practitioner to do the other things that you can do and do really well. And then that patient's getting good care. And then it's not nagging you in the back of your brain, like, what else could I do for this patient or whatever?
Yeah,
Because you've handed it off to someone who's capable and can communicate with you and take care of it. So I think that's something that I don't think we always think about. I mean, the health of our profession is something that we all think about
yeah.
um, in different ways, and we're all trying to address in different ways. But
hmm
we certainly sometimes I think we forget the simple things like. And when I practice emergency medicine, I remember there were times when I'm like, I'm not really sure what to do here,
Yeah,
and you forget that there are emergency clinics all across the country that are open that have a telephone. And if you get to know just one or two of them, if you're in a place where like, I don't know what to do, you can call them and they'll help you. And
yeah.
and so we forget that as a profession. We can help you. We can help you take care of your patient. We can help you with better outcomes. We can take some of that stress off of you because we can pick that patient up and take care of them.
I think this is one of the coolest opportunities too. I know it's a pretty interesting time with all the tech that we have out there. So many things are going on, brand new tools and different type of software coming out. I feel like almost every other day about
Mm.
how you can make things more optimized, and I love all that. With that, I also think about the fact that man, when you look at going to rehab clinics and going to your vet, like there's very few places where people have to go and have human interaction these days. Like there's very few community spots
Mm.
to go to.
Yeah.
And I really see this as a great opportunity for people to get re-engaged with their actual community and in a very meaningful way, probably during a time when they were kind of stressed, right? About whatever's going on. And
Hmm.
and I think it's a great way to kind of have some people around the corner from them that they can go say, oh, I have a guy, I have a doc, I have a gal that can kind of point me like in the right direction to help me out. So man, Doc, this was great talking to you, man. It's always nice to really talk to people that have experience on both sides, and you can help kind of give me some more insight, and hopefully the actual audience gains some too. But do you want to leave any way that people can reach out to you if they have any questions, or you want to give your actual website so people can
Yeah,
find you?
so our umbrella company is metavetproducts.com, and you can check out custom orthotic. We have soft bracing, we have the e-collar alternatives, we call it. And so, yeah, just go check that stuff out. If you have questions specifically for me, you can reach me at paul@goherogo.com.
Go hero, go. I like that, man. Last question. I said I would stop, but just one more. What
Yeah,
is
it's
your
all
actual,
right.
what is
We're
it?
good.
What is your actual number one selling product right now?
Oh man. Depends on the company, right?
That's
so
right.
for a hero, it's stifle braces.
Okay.
Yeah.
Stop with braces.
Yeah. For dog legs, we have a number of products that kind of all are high on the list. Certainly, the what our company was named after, dog legs, is a great product for dogs that have elbow hygromas and
Mm,
shoulder injuries. We have a hobble system that we add to that. So yeah, it's really good. And we also have have my little examples. We have stuff like these braces for ankles and wrists too, if we don't need an orthotic yet.
that's cool.
And then the other products, they're still kind of in line with bracing, like I said, or cone alternatives. So a lot of good stuff out there.
Man, you are busy, man. Dr. Paul, man, this is great having you on the show, man. Thanks so much for blocking out some time so we can chop it up.
Yeah, no, thank you for having me. It's been fun.
Absolutely, man.